Tonight, we're talking to a local medical expert about the spread of the coronavirus in other states compared to here in Rhode Island.
Eyewitness News reporter Courtney Carter also asked about comments by a World Health Organization official that caused confusion about the risk of asymptomatic spread of the virus. Courtney joins us now with what she's learned.
At the same time that the World Health Organization released comments on asymptomatic spread, the hospitalizations in Rhode Island have been steadily decreasing. But local doctors say that does not mean that we should ease up. While some states like Arizona and Texas have coronavirus numbers that continue to increase, the number of hospitalizations and intensive care patients in Rhode Island have steadily declined since its peak in late April to early May. But Dr. Laura Foreman, Chief of Emergency Medicine at Kent Hospital, says although she is aware of the numbers, it's too soon to lessen what we are all doing.
I know it's a hassle. I know everybody wants to be back out and resuming life as normal. We're not there yet. We just last week hit our highest single recorded number of cases in one day, 100,000 cases worldwide. We're nowhere near the end of this, unfortunately.
At the same time, Dr. Foreman calls the World Health Organization's statement about asymptomatic spread being rare confusing. And she wasn't the only one. Dr. Anthony Fauci, the country's top infectious disease expert, says the World Health Organization has to backtrack on its statements about asymptomatic spread of the coronavirus, stating that it was not correct.
Caused a lot of concern among the scientific community, and the statement is confusing, and what the World Health Organization is saying also doesn't square with a lot of the research that's out there. There was a large study released out of China that showed that asymptomatic patients actually were transmitting the disease.
She says another issue with that initial idea is that many people may think they're asymptomatic and they're not, but just have mild symptoms they confuse with allergies or a cold, or the virus just hasn't hit the symptomatic stage in their body yet.
So you feel absolutely fine today, you may feel absolutely fine for up to 2 weeks, and then you'll start to show symptoms. That pre-symptomatic state is highly contagious. Every day you should be behaving as if you do have the coronavirus.
On Monday, Governor Raimondo announced plans to expand testing for people that are not showing symptoms. She says her goal is to test 900 asymptomatic people per day. I'm Courtney Carter, Eyewitness News.